men and women, claiming more lives than breast cancer, colon and prostate cancer combined, killing twice as many women as breast cancer. But there is a stigma associated with lung cancer that only those who smoke will end up getting the disease. So in some way, they are responsible for their illness. The truth is that 65% of lung cancer patients either never smoked or quit smoking years ago. Here with more is Dr. Jessica Donington, also Lisa Bonanno, great stage 4 lung cancer patient. Great to have you both on this morning.
Thank you.
All right, we'll start with you, Dr. Donington. We know lung cancer is the most deadly form of cancer. Is there new hope, though, for people who are diagnosed?
Yeah, right now we have lots of new hope. It's a really exciting time to be a lung cancer doctor because we have new discoveries in the form of CT screening for early detection, better treatments for early stage disease, and some miraculous new medicines in the form of immunotherapies and targeted therapies, which have really made a huge difference in terms of lung cancer cures. It's an exciting time in lung cancer.
That is exciting. Great news. And Lisa, we'll toss it to you. You are celebrating 5 years since your diagnosis. Do you call yourself a survivor?
Absolutely. I'm surviving lung cancer every day, and this September it will be 6 years since my diagnosis. And because I was stage 4, I only had about a 2% chance of making it to 5 years, but because of the amazing research and clinical trials and all the new treatments they've come out with in the last few years, I'm able to sit here today and actually feeling pretty well.
Wow, that is great news. And how do you feel about the lung cancer stigma?
I believe it's definitely hurt lung cancer as far as the federal funding dollars that are designated to lung cancer for research. And people somehow believe that either you can only get lung cancer if you've been a smoker, or that you somehow caused your disease, and regardless of how you got lung cancer, no one deserves it, and we all deserve to have a fighting chance with these great, amazing new treatments.
Yeah, absolutely. Well, Dr. Donington, who should be getting screened for lung cancer?
CT screening is now recommended for those patients who are at the highest risk for developing lung cancer. Those are patients who have smoked a fair amount, 1 to 2 packs of cigarettes a day for 10 years or greater, and really specifically for those who are still smoking today or who have stopped within the last 15 years. If that's someone who's listening today or one of their loved ones, we really encourage you to go to your doctor and ask about CT screening for lung cancer.
Can you explain a little bit more also about the targeted therapy that you're speaking about as well?
Sure. So standard chemotherapies were just medicines that kind of targeted fast-growing cells. But now, because we know so much more about lung cancer cells and what specifically makes them different than normal cells, we now have targets that we can go and to specifically treat those targets. What's a little bit different or unique is that not every tumor is the same, and not every tumor has the same targets. So everyone with lung cancer needs to have their tumor tested to see if they have one of these mutations, where we can give them these special medicines.
All right, any final thoughts that you'd like to leave with our viewers as we close here? Maybe any advice for someone who's been recently diagnosed with lung cancer?
Yeah, our advice is that there is hope for you. We recommend you going to the Lung Cancer Foundation of America website at lcfamerica.org. Learn more about the disease, learn more about treatment, trials.
All right, so new hope out there. We thank you both so much for taking time to share that with us today. And we'll also send our viewers to our website. We will have what Jessica Donington, Dr. Jessica talked about, and Lisa Bonanno right there at fox4morningblend.com.